Hello, everyone. My name is Ivy Wilcher. Thank you for joining us on another episode of Empower Education. I have with me today Dr. Francine Pierce, and she's going to be talking to us today about medications when it comes to ADHD. Now, just to tell you a little bit about Dr. Pierce was born and raised in New York. She practiced as a physical therapist for 3 years and then she attended the University of Illinois, where she completed her doctorate in medicine. She completed a 3 year residency in pediatrics at the Hope of Children's Hospital in Oakland, Illinois. For the last 25 years, Dr. Pierce has practiced as a pediatrician, initially hospital based physician for 10 years, and then she went on to her very own private practice. Now, during that era, she served as a medical director for health promotions for the state of Illinois, where she was the chairman of the pediatric department at St. Franciscan Health. She also served as a medical director, and she's since left that practice to be a medical director of the health equity of Centera Health System in Virginia. Dr. Pierce's passion is the treatment and diagnosis of ADHD, as she has struggled with the diagnosis of ADD throughout her academic life. She has spent most of her career treating and educating children and their families on the importance of diet, supplements, and medication where indicated. She is now working diligently as the medical director of health equity to impact the societal barriers that children with ADHD face in order to improve outcomes and a successful future. I want you all just to welcome Dr. Pierce to the show. I very much appreciate your time, Dr. Pierce, for
Thank
being
you.
with us.
Thank you.
I know I read your bio, but tell us a little bit about you and some things that you got going on now.
Of course. Well, I think the bio leaves out kind of the best thing is that I was your pediatrician.
Yep.
Actually, I did my physical therapy degree at Northeastern University. That's in Boston. So just to make that clarification. But as the bio reads, I've spent a good deal of time doing advocacy for children with attention deficit. It was a personal passion just because of my own struggles. I didn't even realize why it was so difficult for me to read until I was pretty much finished medical school. And, I look back and I said, well, if someone would have diagnosed it while I was in elementary school, even college, that would have made my road through my education much easier. But what it should show is that it's not a barrier to completing education. And I really try to empower families with the understanding that it's a different kind of brain, but it's still a great brain, right? And you have the ability to do and succeed in anything you put your mind to, but you may have to, do some things that just help you focus and do things easier.
I love what you said about it's still a very good brain, but it's just a different kind of brain. And I
Yeah,
that's a big part of the work that I do as an educator, a special ed teacher, is teaching children and parents how to take advantage of and teach others how their brain work. It's not it's no different than you and me learning or whatever. It's just these are the things that I need in order to
right,
be successful. So that's what
right,
I hope to talk with you today about in regards to medication, because I know
right.
medication is a very,
Yeah,
very big thing, and a lot of parents aren't excited about putting their children on medication for pretty much anything. So,
right. Well, before you enter into the talking of the treatment, I think it's really important to understand the diagnosis of ADHD, right? Because ADHD is a catch-all term. And that's why it's kind of like weight loss. How are we going to have somebody lose weight? Well, there are a lot of factors that go into whether a person is actually going to lose weight. Some of their own discretion and, buy into the whole process, and others, what is really causing you not to lose weight? Is it biochemical or is it, environmental? And all of those things apply when we talk about ADHD. So what we're not going to talk about today, which would make it easier, is not children that have such severe socioeconomic issues that it's impacting their learning, children born to any sort of toxic substance, drugs, or anything alike, or head injuries, those kind of things, and children with autism, because at the end of the day, all of those things will lead to a diagnosis of ADHD because those children, when they get to school, will not focus. However, what you and I are probably trying to get to is the parent who has a healthy child who they send to school and really not understanding why they're performing the way they're performing. Because it is really a different discussion to include all those other things. So just to make that clarification, because I think that will help a lot of families.
I think that'll probably be like a great part two of the conversation because I know a lot of parents, that is a conversation that a lot of us do not understand. And medication
Mhm.
usually is the result without considering some of those other factors. And parents still walk away from the doctor office confused because they don't understand the impact of some of those other life situations that occurred and how their child got there. They just look straight at the diagnosis and not consider all the factors. So
Right. So
that's deep in itself. So with that in mind, can you explain what ADHD is and how it affects our children?
okay. So ADHD is a biochemical mismatch because your brain is totally normal and you do have all the biochemicals that you need there. However, they're out of sync with each other. And therefore, if we do a study of the brain and the activity within the brain, within the frontal cortex, that's where your higher centers are. And that's where the difficulty becomes because the brain is almost asleep, right? So we see less activity during that time. And what happens is when there's less activity, those complex things are not able to be followed through. So multi-step commands. So I can tell you, go upstairs, go into my drawer, look on the left side and get a red shirt. You probably got the first two, but you're going to struggle through 3 and 4. Same thing that happens in the classroom. The children receive information, they start, but then they get lost. So then they're constantly restarting, which therefore gets them behind and not comprehending the activities that they're actually working on. So that's how we see it pretty much in our children in school age. Younger than school age, when they're in that 2, 3, 4 age, a lot of children, you'll see that hyperactivity. Children, and there's all ranges of hyperactivity, but usually when a teacher comes to you and says that your child is hyper, that means it's beyond just normal boy energy, right? It's beyond just, he's busy, he's hitting his friends, he's teasing the little girl next to him. It is, he's fidgeting constantly, he's tapping his pencil constantly, he's standing up, he's raising his hand, he's blurting out answers. These are all things that show you lack impulse control. So when we give the diagnosis of ADHD, the main characteristic of ADHD is that there's a lack of impulse control.
So an extreme amount of impulsivity is where that comes from.
Right. Now, people always ask, what's the difference between ADD and ADHD? The biochemistry behind it is the same. However, you find that some children just have the hyperactive component of it. So and young girls usually fall into this category where they have difficulty focusing, but they don't have the hyperactivity. So their diagnosis gets missed until they're much later in their academic career, usually around middle school and high school, because that's when the challenges really start to, prevail.
Now, with that said, if the diagnosis was misdiagnosed, like getting diagnosed with ADD versus ADHD, how could that impact the child going
It
forward?
wouldn't really, because whether you're ADD or ADHD is really just whether you have the hyperactivity. So if you have the hyperactivity, you have the lack of focus as well. So the medications are going to complement both. So,
Now, let's talk a little bit about the types of medication. What are the different types of medication that's effective
mhm.
for ADHD?
So big categories are we have our stimulant medications, which are your Ritalins, your Concertas, Focalins, and those can also be divided into your amphetamine base because there's methylphenidate base, which are Ritalin, Focalin, and Concerta, and there's several more, but those are the big names. And then you have the amphetamine base, which the big names for those are Vyvanse and Adderall. They all function very similarly and they all have very similar side effects. The main thing is decrease or suppression of their appetite. They are a stimulant, just like when we think of appetite suppression for weight loss. You're going to have that maybe jittery or anxious feeling can be part of it. But the biggest one is the loss of appetite, and if given too late in the day, difficulty falling asleep. Now, some children will be sensitive to it and get very emotional on the medication. However, for the vast majority of children, they're not going to have any type of abnormal response to it if dosed correctly. So,
Now, with the loss of appetite, are we seeing that those particular medications are given to older children? Because I'm thinking if we start a child on that medication young, wouldn't that stunt growth weight wise if they're not getting
mhm.
properly, like nutrition to become an issue long term?
No. What we find is that though it will suppress their appetite and they usually stop eating for like their lunch period or their lunchtime, you can supplement with a big breakfast and a big dinner. And your weight, if you're overweight, is going to decline to a baseline, but it's not going to just free fall into malnutrition.
So mainly the medication would suppress the appetite where you skip a meal, but it's not to the point where you stop eating altogether.
Correct. And the degree of suppression of appetite will vary. So some kids really are affected by it, right? So they're going to really shut down their appetite altogether. However, we live in this society where we grossly overeat. So when we think of appetite suppression, we probably bring it down to a normal level more than anything. So, and we monitor that. There are very few children that I've had to double medicate to stimulate their appetite as well as control their ADHD. But if needed, there is a way to address that.
Often a child have to take the medicine. Is it like a twice a day, or once a day, or like what's the regimen?
So typically when people start, especially in the younger kids, they will start with a twice a day regimen, but there is no set way to really start. Some people can start with the long acting. It's just kind of where you feel the child is. And to me, it's easier to kind of navigate the dose when you start with twice a day, because then you can decide whether it was strong and lasted long enough and then go to a long acting if needed, or if they need it to, like for school aged kids, they may need to do it in the morning and they get pretty much through their time, but then they also have school activities after school. So you may need to give that second dose a little later so you get a bigger stretch. So there's no advantage per se, like one's not better than the other. It's kind of what you need it for, where long acting versus the short acting will be the choice.
Can you talk a little bit more about the emotional side effects? I know earlier you said that it may cause, a little bit more of like an emotional. So it's
Were
just
they?
mood swings, or how would
Mhm.
you describe the behavior?
So, and we see that a lot in our younger kids. The children will, cry a lot. You move the salt shaker and then they have this emotional breakdown. It's like, it doesn't make sense why they're crying to the degree that they're crying. Now, again, do I see that often? No. But is it a side effect that we have seen and, tell parents about? Absolutely. So, and that just means that that is actually one of the main reasons why parents will come back and say, oh no, this ain't working for me, is because the child just becomes very emotional and cries all the time and just kind of out of sorts. So of course that can be very disruptive to the child throughout the day. So that is a big reason why parents will say, I don't like the way that my child is responding. There are several medications to choose from and several dosing. So just because the child did not respond appropriately the first go round doesn't mean that there's no options. It just means that we have to do some navigation. And one really important thing that we have to remind parents is when we give you the medication, it is with the complete expectation that we will see you in a month, right? So if things aren't going well, you should be back at latest a month, but certainly within a month, so that we can fine tune it. Many parents just stop and say it didn't work. Well, it's like a chess game. I have to figure out dosing. I have to figure out which medication, timing, delivery systems. There's a lot of different things that I have to make a choice in to get the best outcome.
It sounded like just maintaining and managing the medication could be a job. So for a parent who may ask themselves, like, since I have to do all of this just to help my child stay focused, what would be the benefits of being on medication for that child? Because it sounds like it's a lot of work for the parent if it doesn't work well. But so what
Right.
are the benefits?
No, I would disagree. It's just like if you give your child vitamins in the morning, is a tablet in the morning. And if you give it at school, it's the teacher or the nurse at school giving it. Most people wait till they come home from school to give the second dose. So the giving of the medication is usually not the challenge, unless the child is kind of really just against taking medications. And then we have patches, the child can use a patch if that's an issue.
So they do have patches or a pill form.
Patches, pills, liquid, those are, yeah, those are the main ones.
Sure. So
Mhm.
what are the main benefits of using the medication for ADHD?
Well, ADHD is no different than if I told you you had a thyroid disorder, cancer, heart disease, or anything else. If you are not functioning and being productive at school, then your situation needs a treatment. It's the same idea. So I tell parents when they ask, well, I don't know if I should use medications or not. Well, if your kid is failing or getting put out of school every day, you have to do something, because no point in sending your child to school every day for the, what is it, 15 years that we're in school, and then coming out and knowing nothing. And the first, grades 1 through 3, you're learning how to learn. After grade 3, you're starting to compound your knowledge. And so it's important that we identify what the difficulty is, at least starting by the 3rd grade, but critically important in those middle school years.
So why do you think parents who see the obvious signs of attention and focus steer away from wanting to put their child on the medication?
Well, I think there are a lot of factors that lead into that. Within the Black community, of course, it's just a stereotype, to have your child on medication. A lot of people feel that there is, of course, and to an extent there is a racial bias where more Black children are put on medications versus white children. So the stigma associated with medications is huge. If you look back historically, methylphenidate didn't always have and still doesn't have a great reputation, right? Because you have somebody who may have had a whole list of psychiatric diagnoses, but was put on Ritalin. And then they said he was on Ritalin and he went crazy. Well, the likelihood is that his diagnosis wasn't truly just ADHD. There was probably a lot of other components that played into that. So that's when I say that diagnosis and the blurring of the lines, like children with a thyroid disorder, if it's uncontrolled, can be hyperactive. Children with anxiety, when out of control, can look unfocused. Children who haven't been fed in days and malnutrition have difficulty focusing. Children who are being abused also go to school and are not focused. So all those same children have a diagnosis of ADHD. So when they have abnormal responses, or they have a doctor who just is increasing the dose and not really managing the patient, and then they have, this zombie effect, the parent immediately says, well, I don't want my child to look like that. But that's such a complex, issue, right? Because there's so many other things that went into that that we really can't compare. And so many times I have families come in and says, well, my cousin's on this and this happened, so I don't want to take that. Well, you have no idea really what's going on with your cousin and what might, be misdiagnosed, overdiagnosed, overtreated, undertreated. So you can't really compare at all what is going on with somebody else.
I think that becomes the common thread for a lot of parents because they look for other parents to relate to and they want to figure out, okay, well, if that happened to your child, then the same thing's going to happen to my child. And like you said, without knowing the full workup and how that affects that child may not be the same for their child. So I'm glad you pointed that out because it's important for our parents just to get the information for themselves. So
Right.
good. So would you be able to also talk about, we you kind of talked about the loss of appetite,
Hmm.
being a little moody, also maybe sleep as
Difficulty falling asleep. Uh-huh.
any other potential drawbacks or side effects that parents should be aware of outside of
Yeah.
the ones that you spoke of?
So if a child is born with a heart defect, that is the number one contraindication, meaning you cannot take it a scenario. So a child is born with an abnormal heart, usually one requiring surgery. That child would need clearance from their cardiologist before they could use it. Other things like if the child has fainted in the past or had what we call a ventral septal defect, usually those do not prevent us from using the medication. But again, any congenital heart defect or a heart defect that the child was born with, we would have cardiac clearance before we use any of the medications.
That makes sense. Moving on to decision making and processes for parents. How should parents approach the decision of whether or not to medicate their child?
Well, it really comes down to what I alluded to before. If your child is to the point where they're failing in school and or getting kicked out every day, then you have to start considering options. Now, we started with stimulants. Stimulants are not the only option, but they are the most effective option, and they are the option that will correct the situation immediately. Other options are non-stimulant medications. In our younger children, we tend to not start with stimulants. We start with the non-stimulants, which is your clonidine, which we typically use more for sleep, and your guanfacine. Guanfacine also can be very, very sedating. So we start with it with the expectation that we probably will have to manage it a little bit. But for some children, especially in that 3 to 5 age range, they do quite well on the guanfacine just to slow them down enough so it makes their activity in school.
So the medication is based on the level or intensity of their impulsivity and their inability to focus. Like, do you decide that way too on which type?
So it's symptom based. So as much I may have an adult on 5 milligrams and a 5-year-old on 10 milligrams. So it's not age based or weight based. It is based solely on symptom control. So in saying that, that's why parents get really upset when, they're like, oh, my child is on 10 or 20 and they're only 5 years old. But if that's the dose that needed, because it's also about how your body responds to medication and the metabolism of it. So how you react to medication may be completely different to how I react to the very same medication. So that's where the dose difference may come in. So, when we look at the medications, that's what it's all about, because that part is really a collaboration. When I first started practicing, it was my whole idea to start with all of the non-pharmaceuticals and then, pharmaceuticals only if absolutely necessary. However, in practice, what I realized was that if I do a trial with the parent with the medication in the upfront, a lot of times if we see complete resolution of their symptoms and the child does well, is eating well, all of a sudden the grades and behavior are improved. Now we've corrected a situation within hours that we could have spent a whole year trying to do the other stuff. So there is a place for medication, and it takes just education and a lot of reassurance. It's so important to have a relationship with your doctor where you can say, I'm afraid of A, B, C, and D. And then it's my job to tell you why A, B, C, and D either are real or not real and how we can address it, so that you have a comfort level.
Now, you talked earlier about, non-pharmaceutical um, routes for treating
Mhm.
ADHD, impulsivity, and attention and focus. Can you talk a little bit about what would some of those alternatives be?
So, I mean, out there, because, ADHD is a huge market, right? So you have a lot of things marketed to improve ADHD. Now, if we just go based on supplements, so zinc, magnesium, iron, the omega fish oils, those are kind of your big supplements that people go to in treatments of ADHD. The research doesn't really support much more. I mean, vitamin D, a marginal improvement. Zinc shows improvement in the focus, but not the hyperactivity. And the omega fish oils show a reasonable amount. Well, I should say that children with ADHD already, when they're studied, are found to have low levels of omega fish oil, omega fatty acids in their body. So when we supplement with that, we certainly see a level of improvement. But I will tell you, in my experience, the unfortunate part is if you're just trying to do supplements, the likelihood is you're not going to be effective enough. Now, if your child is just, he's a little distracted, moves around, fidgets a little bit, can supplements be enough? Potentially. But if your child is the one who is getting put out of school, failing his classes, is really just overall at home and at school completely disruptive, the likelihood that supplements are going to make the difference is just very small.
You talked about those different supplements like omega, the omega
The
fit.
omega 3,
Oh, yeah,
3. Mm-hmm.
those seem like vitamins and medications that focus like brain
Mm-hmm.
activity.
Yeah.
So, can you talk a little bit about like some things that parents can do at home if they don't want to do the supplements and they don't want to do the medicine that'll target like the brain holistically outside of, medication? Because some parents won't even do the vitamins. So, is there anything they can do
Right. That.
internally?
So when we look at ADHD, the reality is it has to be all encompassing, right? It is an improved diet, and there are many ways to look at the diet. Why are we seeing so many kids with hyperactivity today versus 50 years ago? The likelihood is a lot of the additives in our food are challenging our brain. Even if you and I go on a diet and we restrict, colored foods and, things that have aspartame and those kind of things, our brains naturally feel better and we naturally focus better. So diet, by and large, and looking at your child eating a high protein, good fat diet is probably the first step in improving your child's behavior. You know, even it's, I could probably go on. We would probably need, series 7, 8, 9, and 10 for me to talk about just kind of even how parents are, unfortunately causing increased behaviors, not only in their inability to discipline appropriately, but constantly giving their children snacks. Like they need a snack for everything. They're not puppies. They don't need a treat every time they do something good. We need to, reprogram ourselves to understand that we do not need food and food and food and sugar upon sugar upon sugar. Think about it. Most children come home. What do they get? A cookie, a glass of milk. I mean, you know how much just in that, how much sugar that is? And then they're expected to go and sit and either do their homework or, sit at dinner or anything like that. It's just not going to happen, right? 'Cause
Almost like we're
we,
fighting against the machine. We gave them 100 milligrams of sugar, and we like, now sit down and do your work. They're like,
But the other thing parents need to understand is that really when we do the studies, sugar is not the issue, right? It is the artificial dyes. Those play a much bigger role than sugar ever has, because you think we've had sugar in our diet forever, but ADHD has not been impacting our kids the way it is now as it was 50 years ago, right? So it's clearly not just sugar. They also look at like the artificial sugars and then the aspartams and those kind of things. And those do impact. They are not the end all die all. But the things that we do identify is for sure the red dye 40. That's a really big one. And then, that's why we recommend either there's something called a few food diet or an elimination diet, where we take out the things slowly out of the diet to see what is it that your child is reacting to, because truly that hyperactivity and that lack of focus could be a form of a food intolerance. So that's where your diet will play a big role.
President wife, Michelle Obama, she did a lot to make sure that schools take those vending machines out of the school, which had the toxins in it, the soda, and a lot of that,
Yep.
unhealthy stuff for the high schoolers. And I know some
Yes.
things have been done, but I still feel like there's a lot of work to be done.
There is. And you know what? Our society needs a lot of work, right? Because we're not talking about an ADD diet. We're talking about changing the whole way we embrace food. Even as adults, we're constantly eating, constantly snacking. That's just not the way our bodies were meant to function optimally. If you have breakfast, which, again, that's a made up thing too, breakfast is not the most important meal of the day. In children, because they've been programmed and raised that way, having your breakfast, your lunch, and your dinner is important in the routine that we set up. But that breakfast really should be protein, protein, and more protein, right? It should not be cereal. It should not be, even if you do pancakes, just not pancake syrup. Use pure maple syrup, use sausage, do things that are hearty, that don't raise our blood sugar and cause our blood sugars to fall mid-afternoon, because that's where all the kids start, getting all antsy. So it's important that if you're going to start it, don't start with chocolate milk and orange juice and those kind of things. Try to get a very high protein, good diet and low sugar in the morning for sure.
Another question I wanted to ask you before we talk a little bit about monitoring and adjusting the treatment. If a parent wanted to, make a decision for medication, what is the
Mhm.
process at school to even for them to start this conversation, like with you or with the school?
Mhm.
What does that look like?
Well, it's important that the schools are equipped to do what's called a Connors, which is a screening. And they should do anytime there is a child that's having any difficulty. The school is required to do their own set of screening tests and things to identify what could be going on with this child and what the child may need. But subsequently, you need to go to your pediatrician. And that I would probably start with your pediatrician, because they will also do a screening. But if you feel like the situation may be beyond just ADHD, it's really important to have a neuropsychiatric exam, because that is because if you look at the screening questions, really anybody could answer them. And then if you really are biased, you know what to check to make the diagnosis of ADHD. However, if they go through long battery of tests, then you might better identify, is the child dyslexic? Does the child have anxiety? Does the child have oppositional defiant disorder? All of those things will look very similar within the classroom.
So the paper assessment or whatever the assessment is that they do, the teachers do, it just gives you an idea of what's going on in the classroom, what they observe, but not what's going on inside neural things that could be contributing to the ADHD.
Right. Right. So, and understand the vast majority of children are only clinically diagnosed for, and that is what determines that is doing a questionnaire by a parent and a teacher. So you have to see the dysfunction in two different scenarios, and it's a battery of questions that delineate, hyperactivity versus like emotional disorders, where you like the oppositional, defiant, those kind of things. All of those get mixed in there. And depending on your score, then you can determine whether it's ADD, ADHD, or other things impacting your child.
Talked about the definition of ADHD, and you said a few times like dealing with chemical, like chemical imbalance and things like that.
Mhm.
So my question is, if the parent doesn't do the further examination, like the neuro testing and things, and then they just go straight to medication, could the medication that's given to them clinically based off the observation kind of go against what's going on the neuro?
Likely no. So, so for example, treat a child who truly has anxiety with a stimulant. Could that worsen their anxiety? Absolutely, right? So if it's more that they go to school and they're so socially overwhelmed that they can't do what they need to, so they have these additional behaviors, and I give a stimulant, their symptoms would only worsen, right? But to be honest, when we say neurochemical imbalance, it's just allowing the chemicals to work in sync with each other. So they're not there. But the basis for a lot of our neuropsych disorders is some level of an imbalance. So for children with autism, they're treated the same way as children with ADHD, right? The symptoms and the scope of their dysfunction may be broader, right? They may be nonverbal. They may not be able to transition between activities. We don't expect that from a child who is without autism to have all those other difficulties. So, although, yes, it's great, and honestly, to get your accommodations in higher education, you need the neuropsych evaluation. The screening test usually is sufficient to identify which direction you need to go to. And honestly, again, everything is trial and error, and there should be a lot of discussion and follow up that if the stimulants are not making things better, then we're going to start shifting our management into another direction.
'Cause I know there is a very long wait here in the state of Indiana to even see someone to get tested. So that's another huge conversation. Is like getting in to see a specialist or to see a doctor.
And
It's
that's true everywhere.
it's just been a
Yeah.
wait. So you do have some parents that want more information, but they're at the mercy of the physicians or the specialists
Mhm.
in order to get it. And that could be a little
Yeah.
frustrating as well.
Yeah, it's very frustrating. And it's hard because I'll tell you, it's frustrating to be a physician who treats it. It's frustrating to be a parent who has to deal with the child who has it. Because again, we're talking about the healthy child that has safe, balanced home, that has some school difficulties. Now, we have to continue to realize that when we broaden that out to the children who have socioeconomic issues, the children who have autism, and all those people still need those same services. And that's why the system is vastly overwhelmed.
Now, let's say the parent decided to go ahead and try out the medication. How should that parent and the doctors monitor the effectiveness of the medication and the side effects?
So we call stimulant medication on-off medications. That means the day I give it to you, you're going to have for it, depending on if it's a short acting, 4 to 6 hours of effectiveness, and if it's a long acting, usually 8 to 10 hours. So when you give it, some people wait to the weekend so they can monitor it for themselves. Some people send them to school. There is nothing catastrophic that's gonna happen with the medication because any physician usually starts out with the very lowest dose. So usually when you initiate it, you're either going to have no response or a minimal response because we're starting at very low doses. Okay. And then when we look at the response, we take a Vanderbilt, which is the screening tool at the start, and we use that Vanderbilt to kind of measure how the child is responding. Is he or she getting symptom control with it? So when you start it, I've had many parents call me and say, I think something's wrong. They're sitting quiet and reading a book. That's kind of what we're hoping, right? But they have never seen their child in this controlled, quiet state. So it seems very abnormal. But for the most part, either the child is going to complain of a stomach ache And usually that stomach ache lasts for the first couple of weeks of initiation and then kind of goes away. Some children can complain of a headache, but again, it's usually just through the initiation about a week or two, and that usually goes away as well. And then the suppressed appetite. So those are the three big things that you'll be watching out for. And then what kind of response overall does the child have? A lot of times I tell families, give the medications, do tell the teacher that you're giving medications, and just see if there's a change in the notes that come home. And a lot of times the parent will get a call that says, oh, I don't know what was happening with little Johnny today because they were just so quiet and well controlled. Yeah. So in the box that we're talking about, the children who really just have difficulty focusing, all other extenuating circumstances are within reasonable limits, those children respond quite well. And you will see that and when we say small doses, medications are dosed differently. So for Vyvanse, 20 is a small dose. For Focalin, 5 is a small dose, but they're equivalent. So it's not a matter of saying, oh my God, 20 is such a high dose. It really depends on which medication you're talking about.
Now, you already shared with me that you had your own personal experience with ADHD.
Mhm.
But based on your experience, what are the common concerns that you've noticed that parents have about medicating their children for ADHD?
Well, the stigma is probably the big thing. I don't want my child having a label. I don't want them being treated differently. So, like for example, for me in school, I always tell this little funny story. I was probably 11 or 12. Right at that time we took our Iowa basics, and I walked into the kitchen. My mother was crying, right, because she had just gotten my Iowa basic scores, and she's like, I don't think you're ever going to graduate from high school. I was like, and that's because I wasn't a problem at school, but I wasn't sitting for any 4-hour test. I started making pretty little designs. So, at that point in time, she was like, oh my God, what will happen with my child? Put into the right scenarios. I had, an attentive family, that was all about education. I had good nutrition. I was guided. It also came down to, girl, you better go to school and you better do the best you can. So there were a lot of expectations that were on me to then do better, right? So as time went on, those came not only externally but internally. So I learned to kind of figure ways into focusing better. And these are things I train my patients to do. One, when you do work in short segments, maybe 5 to 15 minutes at a time. Make sure there's not a lot of distractions. Use things like dry erase boards so that the child is active. Like if you tell them, say you're working on social studies or science, have the child draw what they are learning about, right? So for one, it's kind of fun for them, right? They're actually drawing, they're doing an activity, but now they're using all their senses. So it's not just about just kind of learning just that from the audio. Now you're seeing it, now you're writing it, and you're actually kind of preventing all those other distractions by having other activities. Playing like soft music behind that automatically, focuses your brain. So, that the whole idea that when you listen to Beethoven or classical music, that you stimulate different parts of your brain, there's plenty of science behind that. Encouraging your student to do that, have music playing behind. Standing while they study also will help focus them during that time. I used to use a lot of index cards so I could write on one side a word and then the definition on the other. And now I'm playing a game, like I'm flipping the cards and trying to remember which one. So I'm using all my senses to help myself learn in that time.
Strategies you gave, because I can see myself using those in the classroom. But
Mhm.
help to just when you were talking about like the amount of support that you had in your home, which helped you, progress and help you manage your ADD. But about those individuals who don't have that support, you talked a lot about those who come from different social economic backgrounds who have a plethora of different things going on. What have you seen being done in your experience and in your research with those parents? Like how are those parents managing the ADHD for that child?
Well, so the first reality that we have to accept is that usually a child with ADHD has a parent with ADHD. So, so you usually are struggling, with the parent following your directions because, they're not following through either, or they can creating those, environments. So that's where, now we're having a different discussion, right? Because we have a lot of challenges. We likely have a lot of dysfunction around the home. There's probably no structure, no expectation of discipline as far as you sit down, you study, you get your work done before you do anything. You know, those things are, I think, just lost a lot in these generations more recently because we've kind of fallen away from that structured home environment, right? And there are many reasons why, two parents working, all right, there's not somebody home to oversee the children all the time. That makes a big difference. And that's not something we can necessarily erase because economically, most homes need two parents working. So there's a lot of reasons of why we do have so many families that the parents aren't at all interested in educating their children. They don't create a learning environment for the children. They're not giving good nutrition. They're not setting limitations like bedtime, and just common respect for elders. So when you don't have those things, you really can't expect your child to go to school and then be this scholar. But if the child is tested, I would 100% tell you that somebody's going to say they have ADHD when really they actually need better parenting and better nutrition.
So is it a way to rule that out? Like how have you seen schools or even when a parent brings a child to your office, like how have you been able to decide if it was environmental or was it actually something going on, within that child that's causing
Yeah.
tension and so
So, again, this is all part of having a relationship with your pediatrician, right? So, to some extent, like when I have a parent who's well meaning but a little dysfunctional, we can have that conversation, right? I can be like, girl, what you doing? Let's keep it real, right? Um, However, medication in that realm is at least bring the situation to some level of control, right? Probably it's not going to correct everything, right? Because so much of what makes a child successful is what expectations the parent puts in them, right? You can do what I tell you can do because I've made you feel to a certain level that you are capable of doing this. However, what do we see in most families? You're retarded. You're stupid. What are you doing? Get out of me. You make me sick. Da, da, da. And all these very toxic conversations that make the child feel unempowered. So therefore, you have a whole nother section of difficulties. And I always say, people worry about should I medicate? I can fix ADHD. I have a much harder time fixing low self-esteem. So if I'm able to help a child learn and now they see they can be successful in school, then the self-esteem follows. But if I leave you untreated and then just say, do the best you can, and you're constantly failing, you're constantly getting in trouble, then you realize not only will they not be improving in school, their self-esteem won't be worth much. And that's what leads children into wayward activities because they don't see themselves and value themselves at that
sure. And I know social emotional learning has been a very hot button topic within the schools and to the point where they're even doing more training and embedding that in the curriculum. So some efforts have been made to reduce
point.
the amount of medication or reduce the amount of social work services that students need, which ultimately result to, I feel like, more medication.
Mm-hmm.
Still feel like a lot of people want to avoid the conversation around disability or ADHD because of the stigma, the myths, and the different negative connotations that come behind medication when it comes to ADHD.
Right. Right.
I'm just thankful that you were able to kind of break some things down for us today because this is something that's on an uprise, especially in some of the urban communities that I have worked
Mhm.
in. I've noticed that I've seen more and more, even older high school students being diagnosed with
And
ADHD.
adults. And adults. Yeah.
And I don't know if
So
it's due to pandemic or is it just,
worsened it.
yeah.
Yeah. So if we're being honest with ourselves, we have a failing school system and we have a very dysfunctional society when it comes to our home environments now, right? We're losing ground and not gaining ground. And if parents want to know what they can do better, make your life more simple. Take out the electronics, take away the cell phones, keep your home environment very, very simple where, you're getting up on at a reasonable time, you're eating healthy foods, you're, limiting TV, computer, any type of activity to maybe 2, 3 hours a day at most. You're getting back out and exercising and having kids go back to playing like they normally played, right? That's the best ways that you can impact your children and make the difference.
We got to get back to eating.
You do. And that's why I mean ADHD and obesity and cancer and all of those are all going in the same direction because fundamentally we have the same thing impacting them, right? And there are a lot of diets out there, there are a lot of supplements out there, and I would caution parents on going nuts on a lot of that stuff. There is something called the Fine Gold diet. That's something they can just Google Fine Gold. They have diets based on autism, anxiety, ADHD, and it removes a lot of the preservatives, but it's a stepwise guide that can help families figure out what to do with their diet. You can also work with a nutritionist or an allergist to do an elimination diet to see, are there foods that really are biochemically affecting your child, causing inflammation and this lack of focus. So there are a lot of diets that you can find online. So Googling and just getting an ADHD diet is one. The very specific one I know is that bold diet.
Yes, I really appreciate your time. Do you have any closing remarks or anything that you want to share with our listeners that would be helpful in helping them make a choice or a decision when it comes to the medication? Right.
Sure. I mean, and probably more continuing with that last comment, let's take our children back and start first with creating learning environments. From the time your child is born, you should be setting up that surrounding that helps your child feel empowered and have expectations of learning and growing. Put in the time to do good nutrition, good sleep, good sleep habits, those kind of things. Speak to your child in very positive words of encouragement. Those will fundamentally help your child show up at school in a much better state. And then when you find that you've done those things and yet your child is still struggling in school, a couple of things that you should know that are available to you is that No Child Left Behind is the government's guidelines for public schools should be providing for your child. So be familiar with that. The CHADD organization, CHADD, is the National Organization for Attention Deficit. And so you can go on their website and they have a wealth of information for you. The Pfeiffer Institute also is a huge institute for biochemical imbalances that parents can take advantage of. Some of those things that I've mentioned are expensive and time consuming, but some of them are great resources. So I don't think parents should look at ADHD as a learning disability. It is, as I said in the very beginning, it's a different way of learning. And once we can create an environment in which the child can learn and give them the tools that they need, the child will do wonderful.
Dr. Pierce, I know you're doing some research right now. Is there anything from your research that you can share with us that we can be looking out for? possibly? Do you have a book coming up? Or
I've been quote unquote writing a book for 20 years now. No, actually, I'm not actually working on any research. I've kind of switched gears and I'm working in health equity. So by working in health equity, we are really looking at the research, looking at what areas are impacted by various things, various cancers, and the social disparities, those kind of things, and seeing how we can create tools that can help balance that and get people what they need in order to learn or in order to be, have better health in general. So,